Hello and welcome to all of our Kauai Delta advisory groups and ambassadors and our foundation board members who've joined us today. This is our bi-weekly update, and today is Thursday, January 14th. This is our 34th virtual community meeting. My name is Deborah Volleson, and I'm the Director of Community Engagement for Kauai Delta. It's been a few weeks since we've had one of our community huddles due to the holiday season. But we are continuing to surge here at the hospital. And I know most of you are aware of that because you're looking at our daily snapshot and you're emailing. But I appreciate those of you who are continuing to attend these meetings and stay engaged with our hospital. The best way that we can get information out to our community is by having meetings like this, sharing information on social media so that you can take what you hear and share it with your friends and family. We will post the video of this meeting on our Kauai Delta website. And we also will have the transcripts available for you to review. Gary, back when we started the Community Engagement Initiative, the fall of 2017, you really wanted the focus to be on transparency. And I truly believe that that commitment to transparency has been invaluable for this pandemic. And so you guys send in the questions, we get the answers, and thank you for sitting down with us 34 times and just answering the questions. And we've talked, some of the questions have been hard and we've had to investigate the answers, but we've learned, everyone in this room has learned so much about our hospital, the pandemic, what the community wants to know. So thank you and welcome to our 34th huddle.
Thank you, Deb. It's good to be back. Welcome to all of you. And I hope all of you had an enjoyable holiday season as best as it could be. Obviously, a little bit lonelier this holiday season, but I certainly took some time just to, again, connect with family, even though it might have been over Zoom or the phone, and but just to take a moment to count all my blessings, because so many others are so less fortunate, and that we'll talk a lot about that today. But it's great to be back.
Well, thank you. Well, let's jump in. We've got a lot of stuff to cover in our brief time. So you always start with the numbers. So let's talk about the numbers.
So Casey, where do you want me looking? I have two cameras here, a streaming one, and I'll look at this one in particular then. So, well, just about every single number I will make reference to today is exponentially larger than it was when we last met, because it's really been just over the last month or so that we've really seen what is being described as a surge upon a surge. So there's no doubt about it. It's been a very challenging, struggling time. It was unfortunate that it was occurring right over the holidays, which are supposed to, again, be a time of celebration and joy. And it was really hard to do that, just what we were experiencing. So start at the state level. As of yesterday, the state has now performed 37 million COVID tests since the beginning of the pandemic, of which 2.8 million Californians, or about 7.5%, have tested positive for the virus. But over the last 14 days, that positivity rate is now at 13.3%. So certainly almost double what it has been over the duration of the pandemic. So definitely the last 14 days have been much more intense. And that 13.3% is up about 1.5% over where it was the previous 14-day period. So we're definitely experiencing a spike on top of a spike at the state level. Sadly, there have been now 31,102 COVID-related deaths that have been reported by the state. That translates into about 1.1% of those that contract COVID. So the 2.8 million since the beginning of the pandemic, 1.1% of them have died from it. And that number has held relatively constant throughout the pandemic. So that also equates to just over 78 deaths per 100,000 population. So that number has growing. Obviously, the population is staying constant, but as the number of deaths rise during this period of pandemic, and why that number is always of interest is people say, well, how does that compare to the flu? You know, if the flu runs October 1st to say April 1st of every year, and there are almost 40 million people in California, you know, how many die of the flu per 100,000? And I've reported in the past, it's just a little over, right around 20. 20 deaths per 100,000 die nationally each season as part of the flu. So the COVID, well, number one, it's so much longer in duration. I mean, you know, the flu might last 6 months. We're almost at the 1 year mark. So that is going to certainly make the numbers a lot different. Some things you might be interested in, and keep this in mind as I move to the county numbers. But statewide, of those 31,000 plus that have passed away from COVID, 57% of them are male, 42% of them are female. In terms of ethnicity, 47% of the deaths have been within the Latino population, 32% within the white population, and 12% within the Asian population. So those three ethnic groups account for 91% of all the deaths in California. And in California, there are currently almost 23,000 COVID positive patients that are currently hospitalized throughout California, of which about 22%, almost 5,000 of them are in the ICU. I was also going to share with you again, in terms of those 31,000 deaths, 75% of them are within the population that is 65 years and older. So we continue to see that while a very high percentage of younger people are contracting the virus, those that are dying of the virus tend to be in those older age groups. So 75%, 65 years and older, another 19% between age 50 and 64, 7% between 18 and 49, and California has not seen a single COVID-related death in anybody younger than 17 years old. So that's, you know, obviously always an important factor when we talk about schools opening up. And, you know, children still contract the virus and can certainly spread the virus, but they themselves, they still have ended up being hospitalized, no doubt about it. But their survival rate is really outstanding. So now moving to the county level. The county has now conducted, with all of its various partners, 336,000 COVID tests since the beginning of the pandemic, of which just a little over 39,000 have tested positive. So that's a cumulative positivity rate of 11.7%. So going all the way back to March to just yesterday, 11.7% of the county's population has tested positive, which, again, compare that to the 7.5% cumulative positivity rate statewide. So Tulare County definitely has been running at a higher rate. And if I look just back over the last 7 days at the county level, our positivity rate is at 19.7%. So again, the statewide positivity rate over the last 2 weeks is 13.3, and for Tulare County over the last 7 days, it's 19.7. We are literally averaging 400 new COVID cases every day over the last 7 days. Just to put that into some type of context, you may remember it's been a long time since we've talked about the colored tiers. We are in the most restrictive purple tier 1, then it goes to red tier 2 and yellow tier 3 and so forth. So we're averaging 400 new cases per 100,000 population not per 100,000, 400 total new cases per day. We need to be below 34 and have to be below 34 for 7 or 14 consecutive days. So we don't even talk about purple or red or anything. We are so far removed from that. We are just focusing everything right now on getting people better. And in terms of the number of deaths, we've had 482 total COVID-related deaths in Tulare County. That equates to 1.2% of all the people, Tulare County residents, that have contracted the virus, almost identical to the 1.1% statewide in terms of the number of people that, again, contract the virus, that succumb to the virus. So almost identical at the state level. And that 1.2% has remained relatively constant throughout this pandemic in Tulare County. And so I think that was one of the questions that was asked. We're seeing so many more patients being hospitalized, so many more deaths. Is it the numbers, or is it because this virus is really, getting stronger and stronger and harder to fight? It really is the numbers. Mm-hmm. We just have so many more people that are contracting the virus that leads to hospitalization, that leads to death. But the rate of those that are dying of the virus is pretty much staying unchanged. 148, or roughly a third of all those 482 deaths, do relate to people, residents of nursing homes. So they've continued to kind of be a disproportionate share of the deaths, and obviously because they tend to be elderly. In fact, very close to the state, within Tulare County, 78% of all the COVID-related deaths are in people 65 years or older, almost identical to the 75% at the state level. About 20% between the ages of 41 and 64, and only 8 people that are younger than age 41 have died of the virus. So that's only 1.8% of the 482 that are younger than 41 that have died of the virus. So, but I don't want young people to feel that they're invincible. And I think that happens a lot, is like, hey, if I get the virus, I'm going to be okay. Maybe I end up getting hospitalized, but my chances of survival are excellent. And you're right, absolutely. But the chances of survival of your parents, your grandparents, elderly people that you associate with is much different. So we ask you to practice those safe practices, certainly to protect yourself, but for that younger population, it's more to protect others, to protect your loved ones and your friends and so forth. So also very interesting and much different from the state. So I mentioned that at the state level, 57% of the deaths are in the male population. In Tulare County, it's almost the exact opposite. 45% of the deaths in Tulare County are male and 54% are female. So the percentages are literally flip-flopped between our county in particular and at the state level. And unfortunately, in Tulare County, in terms of deaths per 100,000 population, we're at 97.8. That compares again to the state's 78.2. And at that level, we rank 5th in the state in terms of the highest number of deaths per 100,000 population. There are 58 counties in California. The Imperial Valley ranks the highest at 234 deaths per 100,000, followed by Stanislaus County at 124.3, LA County at 123.9, Merced at 99.2, and then Tulare County at the 97.8. So Tulare County, Merced, Stanislaus, Central Valley communities, agricultural base, a lot of congregate living. The agricultural population has been hit really hard, almost disproportionately hard by this pandemic. So it's not surprising to see that 3 of the 5 top counties are in the Central Valley. And then lastly, moving to Cahuilla Delta, we continue to be an incredibly busy hospital. As of 7 o'clock this morning, we were in the acute medical center downtown here, where we have 344 beds that we're using for the acute medical care of adults. So I'm not including neonates or nursery or mother-baby. But of those 344 beds, 94% of them are occupied. So we had 323 patients in those 344 beds. We have 41 ICU beds between 2 West and our cardiac ICU. Of those 41 beds, 6 were open this morning. Our intermediate critical care unit, we have 54 beds between 3 West and 5 Tower. Only 4 of those beds are currently unoccupied. And then our medical surgical units, which, 2 South, 2 North, 3 North, our pediatric unit, our 12-bed pediatric unit, which has now been turned into an adult unit. Across all of those medical surgical units, we have 249 beds, of which 11 were empty this morning. So very, very, very busy. We do have a couple of other areas that we have now converted into adult areas that are primarily available to us in the event of another surge on top of the surge. So we took the 6th floor of the Sequia wing, which was a beautiful 23-bed neonatal intensive care unit. We opened it up earlier or back in kind of the summer, late spring of last year, to the sheer delight of our staff and parents. And unfortunately, because of what we're experiencing now, we have moved all neonates off that unit. We've been able to keep, I think, virtually every one of them here and not have to send them up to Valley Children's. And we put them in our nursery or other areas where we can take care of them. So right now, 18 of the 23 beds are open. So we have 5 adult patients that are on that NICU unit right now. And then our endoscopy center, where we do colonoscopies and bronchoscopies, and we've stopped doing them in the endo lab. We're now doing them in our operating rooms. So we've literally converted that endoscopy center into a 10-bed adult unit. So we're pulling out all the stops to create additional beds, but our biggest challenge right now is staff. Mm-hmm. We can always we can put up tents, we can put patients in hallways. We have 14 operating rooms, and we're only using 4 of them right now because we've completely shut down elective surgery. So we could put patients in those operating rooms, but you've got to have the staff to be able to take care of those patients. And we're already stretching our staff so thin, asking them to work overtime and extra shifts and take care of more patients than they would normally take care of, and they're exhausted. Mm-hmm. So that's the fine balance of creating space for our community and our patients, but being able to take care of them, having nurses and doctors and respiratory therapists and so forth.
Well, they're not only exhausted, but some of them are sick.
Yes, but that'll probably be the highlight of my report.
Oh.
So, yeah.
Well, that's good.
I know.
We need some good news.
I should wait to the end to share that, huh? On the COVID front, so again, 323 patients in the acute medical center right now, adults. 157 of them are COVID positive. And right now, 21 of them are in the ICU. We have a total of 27 COVID patients that are actually on a ventilator right now that have been intubated. I think it's a safe guess to say every single one of the patients in the ICUs are on vents, but we've also moved ICU level patients onto 3 West that could be ventilated as well. We also have 4 COVID positive patients that are in the emergency department waiting for a bed to open up. So we'll hold those patients in isolation until we have room to move them upstairs. Frequently asked of me is, because obviously ventilators, and that's the primary impact that this virus has on somebody is their oxygen saturation, their O2, when you put that pulse oximeter on your finger to see how much oxygen is in your blood. And a healthy level is 98, 99%. Some people hit 100. but we see a lot of our COVID patients dropping down into the 80s and 70s and even lower. And so that's when they need artificial oxygenation, either through being ventilated or put on a BiPAP machine or a high flow cannula to help them breathe, because that's really where we're seeing the biggest struggle. And a lot of these patients develop pneumonia. When your organs get robbed of oxygen-rich blood, they start shutting down. We're seeing patients that are having strokes while they're in the hospital, heart attacks, renal failure, things of that nature. So that's where we are on the COVID front. And then lastly, I guess I'll end the numbers on a positive note. So as of the beginning of the virus back in March, we've had a total of 1,035 employees that have gone out on COVID leave, that they have contracted the virus. But the vast majority have returned to work, have recovered. And I always say that's a relative term, because there are many patients that don't fully recover, that they have lingering weakness, breathing difficulties, memory issues, depends. Yeah. So it does leave kind of a residual effect on certain people. And as of Monday, I say we have 157 of our employees that are currently out on leave of absence because they're COVID positive. It wasn't too long ago that we were at 250 and saw that number rising. So wonderful to see that our employees are kind of bouncing back and fewer of them are out. Unfortunately, 5 of our employees right now are hospitalized, and we're certainly praying for them and their families. We also have about another 40 employees that are out on quarantine because they live with somebody who's tested positive. And we have, of all of our providers, our physicians, our nurse practitioners, our physician assistants, we've had 31 of them go out on COVID leave over the course of the pandemic, but only 2 of them are out right now. So great to see our medical staff back in pretty much full force.
Okay. So. Well, that's good.
So those are the numbers.
Those are the numbers. Well, so we have a chat, and I was going to ask you this too. So we talk about children that get it, and we've seen no deaths from children. But what about the side effects? Or not side effects, the lasting effects of COVID. Right. Are they showing those in children?
Yeah, I'm really not an expert to speak to that. I mean, I certainly. I've read a lot about the Kawasaki disease that is commonly seen at Valley Children's that can have an effect on organs and have lasting effects. So we have taken care of COVID positive children here at Cahuilla Delta that have successfully recovered and been discharged home to their family. Some had been transferred up to Valley Children's, but I don't know what the ultimate outcome. I don't know if they've had any lingering effects of it.
Well, and the Navjot, she was just saying that, did we hear about the 3-year-old who contracted COVID and was paralyzed?
I did
Have
not.
We heard about that? Yeah. So as somebody who has had COVID, I am worried about the effects that people are reporting that come after. And I'm sure we'll talk more about that in the future. It's just getting through what we're getting through. So,
right.
Okay, so let's move on, Gary, to vaccinations. But our phones are ringing off the hook, and I know yours are too. So Tulare County has started the vaccination rollout. And so I have a lot of questions, so so first of all, when and where can the community members get vaccinated?
Right. I think this is the first time that we really delved into vaccination, because it obviously just became a reality, really, I guess, in December. So we talked a lot about what Moderna and Pfizer were doing in creating the vaccine, but it now has been shipped and delivered to communities and is being administered. In fact, I think one of the things that, where was it that I had written down? So Tulare County has received 18,275 doses of the Pfizer and Moderna vaccine, but only 5,388 have been administered. So right now, only 1.1% of the Tulare County population has been vaccinated at this point.
Okay, so does that 18,000 include what they gave to the hospital?
Yes.
Okay, so
Yes.
5,000 has been, or approximately 5,000 has been administered. So that includes what we've done here.
That includes what Coweta Delta's done, what Sierra View has done, nursing homes, what the county has done.
Okay.
So that's county-wide, the number of vaccinations.
Okay.
Yes. And I know this is probably one of the most frustrating areas right now, and I have been having to address it pretty continuously over the last week and a half. I've had a number of phone calls with the county. I get calls at home by friends and neighbors and community members, some of them, celebrating that they got vaccinated today, and then others very angry, that they can't get vaccinated. So the state pretty much designed the vaccination rollout plan, phase 1A, phase 1B, phase 1C. I think it ends with, phase 1C. So phase 1A has 3 tiers in it, and they were pretty much limited to just healthcare workers and residents of nursing homes. So the state was emphatic about that's the only people you could vaccinate. In fact, the state threatened to take away the licenses of doctors or nurses or anybody else who vaccinated somebody outside of phase 1A. Mm-hmm. So that's where everybody has been focusing, including the county. But then I hear from folks that are outside of phase 1A, again, people I know personally, that went to the government county office across from Mooney Grove Park and got in and got their vaccine. And they have nothing to do with healthcare whatsoever. And so I was getting a lot of those calls last week. And unfortunately, those people that are getting the vaccine are friends of the people that weren't able to get the vaccine. And there was almost a little bit of gloating, which then just fueled the fire. Right. On Monday, I had an all hands on deck Zoom meeting with the county and with a bunch of our folks, and they acknowledged that was a mistake. The county is using some volunteers to assist in this, and they should not have given vaccines to anybody outside of healthcare in that phase 1A. But it's continued to happen. It just happened a couple days ago, and I had to send another email. And so unfortunately, those mistakes are happening. And I'm not being critical of the county. I mean, the state provided zero instruction or help in how to do this. So we're all kind of struggling to make it work. Just yesterday, the governor came out and said, let's, as a state and as counties, let's move to phase 1B right now. And there's 2 tiers in 1B. Tier 1 also includes anybody that's over 75 years old, and Tier 2 includes anybody that's over 65 years old. So the governor's saying, let's hurry up and be done with phase 1A, which is pretty much almost completely covered, and let's move into 1B. And let's move into both tiers of 1B. Let's not wait to get through Tier 1, just the 75-year-olds. Let's get through, let's do Tier 1 and Tier 2 at the same time. So anybody 65 years and older that wants to get vaccinated, let's start. The county may start that as early as Monday. They may be able to do that. So this Friday and Saturday, tomorrow and this Saturday, Coweta Delta and the county are working together out at the Tulare Ag Center. We're going to open up 10 drive-through lanes, and we'll have 10 employees, 4 clinicians, 6 non-clinicians, staffing each of those lanes. But again, that is supposed to be only for phase 1A healthcare workers and nursing home residents.
This weekend.
This Friday and Saturday is only supposed to be for that group. However, this is a very fluid process, and if nobody shows up on Friday or Saturday, and we've been pushing really hard to get, all of our healthcare workers vaccinated, and but you can only reach out so much, and there's even within Quia Delta, there's about 35% of our employees that are choosing not to receive the vaccine. And I don't mean, I'm not critical of them. I respect their decision. A lot of them are young people that don't think they need to be vaccinated. But that's resulted in a lot of vaccine being left over, and nobody wants to see any vaccine expire. So I think the county will pivot quickly if it needs to on Friday and Saturday. If they find really no activity in that phase 1A, that they're going to quickly move to 1B and start vaccinating. So I wrote down a website for folks. So if you go to a website called covid-19.tulare.gov/COVID-19-vaccine. That is the county's new website that lays out all of the phases and where you can get vaccinated. It talks about their new online scheduling system or phone number to call and be screened to see what phase you're in and to schedule an appointment. So go to that website, and that can really help. But I think we're going to start seeing that 1B, phase 1B category roll out very quickly. So.
Okay, so we're asked what time on Friday and Saturday for this event that's at the Agri Center, and I believe it's 8 to 4.
Yes,
I'll try to confirm
it could be.
that.
I think they're asking for volunteers. Again, that's all on that website. I think they're asking the volunteers to be there from 8 to 5, and that it's running 9 to 4. Because they want an hour for setup and an hour for takedown. So I think the actual vaccinations are running 9 to 4.
Okay.
And then COS just announced that I think beginning January 20th, they, in partnership with the county and Quia Delta, will be assisting in that. They're going to take part of the COS parking lot and create, I think, 4 lanes for vaccinations, which at that time we should be fully into 1B, again, both tiers. So starting January 20th at COS, and my understanding is they're going to run their vaccination clinics Monday, Wednesday, Friday, and they plan on doing it for an extended period of time all the way into the spring. And also Quia Delta's clinics. So we've applied for all of our clinics and our urgent care centers to be vaccination points. So we'll have it in Exeter and Woodlake and Lindsay and Dinuba, on Court Street, over on Demery, and actually be able to vaccinate there as well, just like we do the flu. So we're really kind of taking our lead from the county and really trying to work closely with them. But all of us are really being dictated by the state, and understandably, because vaccines are still not plentiful. They were doled out rather slowly. I think California got 327,000 doses, and we have 40 million people in the state of California. So we need a lot more vaccine to keep coming into the state and into the county so we can get many more people vaccinated.
Well, which leads to the question, and I received a phone call this morning saying, could you help me sign up for that second dose? So that's also a worry that people have. Will we have enough for that second dose?
According to the federal and state government, we will be guaranteed that. So that's been Quia Delta's experience. So obviously, our healthcare workers were in that phase 1A, and they all got their first dose, those that wanted to receive it. They received a card, and we actually scheduled their second dose appointment right there at the time they got their first dose. And then they would get text messages reminding them of when their appointment was. And we received in the our second allotment the exact number of doses that we received in the first. So it was very well coordinated. We definitely ended up with the right amount of vaccine. Interestingly, I don't know if I've talked about this, that the Pfizer vials of vaccine, they come in a very concentrated form, and you have to actually dilute them. But they should provide about 5 doses in each vial. Well, we're finding out that Pfizer overfilled them. And we're actually getting at least 6, sometimes 7 doses out of it. So while we got 5,000 Pfizer doses, we actually ended up with 7,000 Pfizer doses. So we actually haven't dipped into our Moderna vaccine at all. We're just using the Pfizer. But again, we won't let anything expire. And the Moderna vaccine can be stored for 6 months. So we shouldn't have any problem there.
Okay. So we are being asked to repeat. So we're just going to summarize this. The county event that's happening tomorrow and Saturday is for phase 1A only.
Tier 1, Tier 2, Tier 3.
There's the possibility that they could open up phase 1B on Monday.
Or sooner. I think you should stay tuned. I think you should monitor and call the county or monitor that website because they've committed to be there both days. They have enough vaccine to start rolling into 1B, and but they have an obligation by the state to first get through 1A. But that demand is kind of starting to decline. And so the county is very anxious, as are we, to move into 1B. And again, if we don't get much activity in the 1A category on Friday and Saturday, then you got all those people already there in the vaccine. And I think you'll find that they'll launch into 1B at that point, which again, and they probably will go both tiers. So anybody over 65 years old, as well as farm workers, and actually phase 1B, tier 1 alone has more people in it than all of the 3 tiers in phase 1A. So that's a huge group of people that are anxiously awaiting that vaccine.
Okay. And then just to repeat, you can't get your vaccine at Kauai Delta at this time because we are only authorized to give it to Tier 1, our healthcare workers.
That is correct.
So we're not holding it or trying to purposely prevent community members from getting it. Our licensing is at risk if we go against what the state.
As soon as the county gives us the green light that says, yes, Kauai Delta, you can move to 1B as well, which I think as soon as they do, which could happen Friday or Saturday and probably at the latest on Monday, as soon as we get that word, then we can start offering the vaccine to people that are 65 years and older.
Okay.
Now, I don't believe we've got authorization yet to vaccinate in our clinics, but we do have other sites that we could vaccinate.
Okay.
Yeah.
Okay. So, and the second dose, if you went through the county, you just need to go back to the county website to sign up for your second dose.
Yes. And hopefully they schedule your appointment at the time. But I've heard that hasn't always happened.
Okay. So is a person able to choose which vaccine they want? Can they say, I want the Moderna? Can they say, I want the Pfizer?
I don't think so. I don't know if there really is a difference. I mean, one's 94% effective. The other's 95% effective. One is 3 weeks between shots. The other's 4 weeks. They're pretty much identical. They're both mRNA, vaccines. I think it really depends on the availability. We decided the workflows are quite different, so we decided let's just use all Pfizer. We didn't touch the Moderna. Had we worked all the way through Pfizer, then we would have moved into Moderna at that point. But I don't think it's really which one do you want. Okay.
So what phase is child care workers in?
So phase 1B, and they are in tier 1.
Okay.
So
they could...
phase 1B tier 1 are people older than 75 and child care workers. people in education, so teachers, all first responders, those in food and agriculture, those are all in phase 1B, tier 1. But again, that cutoff is 75 years and older. And the people that I've heard from are in that age category. So the county kind of slipped a little bit of 1B, tier 1 in there, along with the phase 1A. But tier 2 of 1B is now age 65 and older. Those that work in transportation and logistics, industrial, commercial, residential, and sheltering facilities, critical manufacturing, prisons, incarcerated folks that are in congregate living, the homeless, they're all in phase 1B, tier 2. But again, when we were in phase 1A, we had to first go through tier 1, finish that before you could start tier 2, finish that before you could start tier 3. That's probably changed. That we're now, according to the governor, just start both tiers in 1B now. So that's why he said start with age 65 now. Don't wait.
Okay. So how many people, is there a percentage that need to receive the vaccine in order for our community to open up, or no?
I've not seen that defined. We've talked about herd immunity, at what percentage, and apparently that's all over the board. All different experts, say different things about it. So I really don't know. I think one of the things that's a bit frustrating is the CDC has still said, after you're fully vaccinated and 3 weeks have passed after your second shot, and you're supposed to now have 95% immunity, can I stop wearing a mask? CDC says no. Can I start getting together with my friends? CDC says no. Continue to socially distant, continue to wear your mask. I heard the other, because you could still, and there's still that 5%. It's like the flu. This actually has a higher immunity rate than the flu, which sometimes can be as low as 30%. But because there is that 5% and you can still contract it and then give it to somebody, I think that's why they're still requiring that.
Right. Okay, so we've had several employees that have received the second dose that are finished with the vaccination process. What side effects are we seeing here? Yeah,
it's all over the board, frankly. So, I brought a document with me. This is from Pfizer, so the side effects generally are fever, fatigue, headache, chills, muscle pain, joint pain. First dose, 5% experience a fever, 26% in the second dose. Fatigue, 41% experienced it with the first dose, 55% experienced it with the second dose. Headaches, 34% first dose, 45% second dose. Chills, 10% first dose, 29% second dose. Muscle pain, 18% first dose, 33% second dose. Joint pain, 10% first dose, 20% second dose. So without a doubt, we saw very little reaction in almost everybody from the first dose. Definitely seeing it with the second dose. In fact, a number of our employees, just talked to one of my colleagues who was hit really hard. It hit her about 1 a.m. She got her second shot in the morning. About 1 a.m. that night or that morning, was in bed shaking, chills, headache, ended up vomiting. But a day later, it's like a light switch and it all goes away. So it's not like the flu that lingers. There's this immune response that's going inside of you. And pharmacists have told me those that experience the most moderate to severe reaction are probably having the best immune response and developing a lot of antibodies. I got my second shot yesterday morning, so I was all prepared. In fact, this is terrible. My wife put a bucket next to my bed last night, had a big blanket for me to wrap myself in when
she was ready.
When it finally hit, and it never came. And I haven't felt a thing. And yet I'm the guy that when he got his shingles, 2-shot shingles shot, I was horrible. I had terrible flu-like symptoms, and so I fully expected it.
Yeah.
But
well, those of us who have only received the first one, we're really watching you guys because
I know.
all of those around us were doing texting reports.
Believe me, they are not dangerous at all. I mean, you don't have to be worried or scared. They will go away rapidly, and there doesn't seem to be any rhyme or reason. Yeah. Dr. Winston actually, she had a pretty moderate to severe reactions, chills and everything. And she's read that younger people are being affected more than older people, which I found very discouraging.
Were you offended?
I was. So I was almost hoping, I hope I have a bad reaction, but unfortunately not. So I must be old.
Funny. That's funny. We're being asked if you can repeat that website one more time, the COVID-19.Tulare County.
Yes.
And we're going to, okay. It is in the chat as well. So if you're, Gary, let's repeat it. But if you also are on this call, go ahead and look at the chat.
So it is covid-19.county.ca.gov/COVID-19-vaccine.
Okay, perfect. All right. So we talking about it, we've kind of had a little fun laughing, but the next two subjects that we're going to cover are really heavy. And so there's been articles in the paper about crisis care. We've put on our website our policy, our procedures if we move into crisis care. The community engagement group, I sent out your news you can use that you sent out last week to all of our employees. I sent that out to them this morning so that we can try to give them as much information as possible. But let's talk about what's happening right now with the ambulances, triaging, and then we'll move into crisis care. So why are ambulances triaging patients? And are they knowledgeable enough to make that decision for care?
Right. So that decision is probably made by the emergency management system agency, EMS, that is based in Fresno for the Central Valley. So Dan Lynch heads up the EMS. I first read about ambulances in Fresno County that were triaging in the field. It kind of came as a surprise to me when I learned that Tulare County EMS and ambulances were doing the same. And I presume it's being done by paramedics. The intention is obviously pretty straightforward, that hospitals throughout Fresno County and now Tulare County are essentially overwhelmed. I mean, 94% occupancy is a little bit of a breather because we've been hitting 97 and 98 and not a single critical care bed open. And so we're doing everything we can to keep people from having to come to the hospital. And I think that's what the ambulance companies were doing. The paramedics are assessing patients in the field and determining whether they really need to go to the hospital or not. They would never do that during non-COVID times. They don't make those decisions. But they were feeling that given what we're all experiencing right now, that, and there often are patients that, don't really need to go to the hospital. They think they're having a heart attack, but they're having an anxiety attack, or they're having a gallbladder attack, which emulate a heart attack. And you can't always tell the difference unless you're hooked up to an EKG machine, and they can do EKGs in the field. So they might say, I'm having a heart attack, but then you do an EKG and no, sir, you're not having a heart attack. And so they were trying to make those decisions to bring some relief to hospitals. I'm uncomfortable with it. I think a lot of people are uncomfortable with it. I've heard stories that poor decisions were made. Mm-hmm. And again, I'm not being critical of the paramedics or that just not their training. Obviously, we want to do everything we can to keep people out of the hospital. In fact, I'm going to have a conversation later today with a a very busy community physician that also happens to be a friend, and he wants to talk to me about the success that he has had treating COVID patients on an outpatient basis and keeping them out of the hospital, and has stated that he's not lost a single COVID positive patient. So I'm very interested to see the course of treatment and the practices he's following. When we talked about Regeneron and bamlanivimab, which is the monoclonal antibody therapies, we're now doing those. You infuse them in our infusion center for about an hour, and that's for COVID positive patients before they get hospitalized. So, they're at high risk because of their age or underlying comorbidities, but we found that this monoclonal antibody can actually shorten the duration of their infection and reduce the effect of it, so they don't end up having to be hospitalized. So anything that we can do, on an outpatient basis to keep people out of the hospital, we're going to try that. But I don't want somebody inappropriately not being brought to the hospital that really needs to come here.
Right. Okay, so declaring a state, I don't know if it's called a state of emergency or what it's called, for us to move into crisis care. Who makes that call?
Yeah, so first let me explain crisis care. And you're right, it is the most serious discussion you can have, and we don't make light of it at all. It weighs very heavy on our hearts to ever have to move into crisis care. But you think back in March and April, and we witnessed what was going on in New York, where they literally, hospitals were overrun. They were taking care of people in the street, in ambulances. They had refrigerated trucks that served as temporary morgues, and they were essentially having to practice crisis care. They were making determinations that somebody that suffered a heart attack, if they'd been down for a certain period of time, they didn't try to resuscitate them, they didn't hospitalize them. They never would have done that had they not been in a crisis situation. So crisis care is when your hospital has been so overwhelmed that by the number of patients, the demands for critical care, ventilators, staff, that you can no longer care for every single patient that needs to be hospitalized. And so you have to make really difficult choices about who you hospitalize and who you don't, and who gets critical care, who gets a ventilator, who gets remdesivir. Somebody that is in ICU that's on a ventilator but has a very low probability of surviving. Do you discontinue care? Do you extubate them because you need that ventilator and that ICU bed for another critically ill patient that has a much higher probability of survival by receiving that care? So that's what crisis care is about. And back in April, when we were watching what was going on in New York, myself, our critical care intensivists, our emergency medicine physicians, many of our hospital leaders, our ethicists, legal counsel, we created a crisis care policy and a decision algorithm, decision tree, using information from the University of Pennsylvania health system and the North Texas University health system, who had already developed pandemic-related crisis care policies. In fact, over the last week and a half, we actually set up our crisis triage command center inside of the hospital. And again, at 7 a.m. this morning, I was in there with the team, and we're walking through the process and doing simulations. And again, we're practicing, because if we ever get there, which we hope we never do, and we will do everything humanly possible to never get there. Again, and that's opening up, spaces that we'd never think to use for patient care. But again, having the staff and pulling people, to the front lines that maybe don't normally work on the front lines. I mean, we will take drastic measures like that so that we never have to invoke that. I was on a call yesterday with the California Hospital Association. I was asking that very question: who makes that decision? And essentially, the answer was the individual hospital makes that decision, because conditions can vary significantly up and down the state. We might be in a crisis situation where other areas, maybe way up north in California, they're not experiencing the same thing. But if we make that decision, and that decision is made in combination by me and our chief of staff, Dr. Mendenhall, who's a cardiac anesthesiologist, obviously in consultation with other physicians, our executive team, our board of directors, we would say we're now at the point where we need to activate our crisis care policy and that algorithm. We then have to inform various entities. The California Department of Public Health is the first entity that is essentially informing the state. We also would inform our local county public health department, and then we would inform the regional emergency management agency that's kind of coordinating. Because what we really want to do, that you're not notifying them to get permission, but they want this to be really kind of a regional, if not statewide response. So if Quia Delta is in a crisis situation, they want to be aware of it so that they can help us, potentially transfer patients to other hospitals that might have capacity. And so that notification is to create potentially that regional response that could potentially prevent us from going into crisis care, mm-hmm. or maybe bring us out of it sooner than otherwise.
Okay. So we are now linked into a region.
Yeah. So you may recall when the governor issued an executive order, the stay at home, mm-hmm. When we were seeing ICU bed capacity was just plummeting statewide. And so he divided the state up into 5 geographic regions. We created ours called the San Joaquin Valley region, which is made up of 12 counties that stretch from San Joaquin County and Stockton down to Kern County and Bakersfield. So those 12 counties essentially are that San Joaquin Valley region. So we would try to work inside of that region to move patients, or maybe bring staff in to help staff other areas. They're actually one of that emergency management system would actually be managing transfers. So normally, if I need to transfer a patient to a higher level of care, Stanford or something, our transfer center will contact Stanford's transfer center directly, and physicians and nurses will make that arrangement. In this situation, because the many hospitals through the 12 county 12 county region, we will centralize that through this central agency that will make those calls and determine what's available for us.
Okay. So I'm sure there's going to be a lot more to come on this, especially if the numbers keep creeping up, because I'm assuming that all of the hospitals in our region are experiencing the same thing that we are. Yeah,
in some cases even more intense. Fresno County, they're seeing the number of deaths, their number of cases. I'm seeing their ICU availability is at 0% almost every single day. So, they're definitely feeling it.
Okay, so a couple of things before we let everyone go. We have 2 minutes, Gary. So let's see how quickly we can do this. A chat. What is the protocol if someone has had COVID with symptoms, recovered, returned to work, and then they are exposed again? So you've had COVID, you come back, and you're exposed. Do you have to quarantine again, or are you deemed? So
I think timely question, because I think I heard the answer just the other day from Diane Cox, our VP of HR. If you had COVID and recovered within the last 90 days and then have another exposure, you do not have to quarantine at home. But if it's been outside 90 days and you get that exposure, then you do.
Okay. So studies are showing that you have a 90-day immunity?
No.
Okay.
No. Yeah.
Did I just make that up? I think I just made that up.
Yeah, there's,
Okay.
I don't think that's where the 90 days come from, but that's apparently what the CDC has indicated.
Okay. So lastly, we talked a lot about PPE and the shortage of supplies that we had earlier on a few months ago. How are we doing with PPE supplies?
Yeah, we definitely, in the whole area of masks, particularly N95 masks, we've really done a great job, Steve Bajari and Maribel, building up our inventory in that area into the hundreds of thousands. So we're in really good shape from that standpoint. But gloves has continued to be a real challenge. I reached out to Devin Mathis, our state assemblyman, probably a month or so ago, and he called me right back, and I told him I need your help. If there's gloves at the state level or someplace else, we're down to, we were going to run out by Christmas. And he worked with the state, worked with the county, and I don't know if it was his efforts, but I'll give him credit. I think he kind of shook the trees, so to speak, and we did start receiving gloves, and we're in a lot better shape than we were. We probably have about maybe a 40-day supply right now, but we could use more. And then also a shout out to the state that we just got 20 brand new ventilators. I don't know if it was earlier this week or late last week, but we put a request in. And the last time we put a request in, we got some broken down, used, unusable ventilators. But in this case, they were new and pristine. Yeah. And we have to give them back when we're done. Yeah. But we greatly appreciate the state providing those.
Yeah. Okay. Well, thank you to everyone online who has joined us. We will put out the questions and answers on our website along with this video. So please feel free to send in questions if you have them. We are working very hard to make sure that you are as up to date as possible so that you can share the information. And Gary, would you like to close?
Yeah, it's great to be back with you. I'll be here from now on, every couple weeks. So
you took a break. How dare you take a break?
I know I did, and I miss this. But just again, thank you to all of you for your continued support of Quia Delta and your well wishes, your thoughts and prayers. And I heard that the County Center Rotary wants to do a walk around the hospital. We talked about it this morning that the Rotarians want to come out strong and walk around the hospital and cheer and applaud for our incredible healthcare heroes and show their appreciation. And I can't tell you how much that means to them. So again, just thank you for everything you guys do in our community and being a part of Quia Delta. And thank you for your great questions. And I really look to you to kind of share this information that's part of that commitment to transparency and being honest and truthful, even when they're difficult questions like crisis care. I want you to feel confident that we're being forthright with you and that you can share that information with your friends and colleagues and family. So thank you, and I'll see you in a couple weeks.
I'm going to add on to that, since you mentioned the fabulous County Center Rotary, which I am a member of. That event's going to be January 26th at noon. And so it will probably be a multi-Rotary. Most of our Rotaries in Visalia will probably participate. And if you're interested in being a part of that, they're going to be holding signs. They're going to be showing some appreciation, and there's probably going to be some food for our staff. So thank you for that, Gary.
Yeah, just a quick note too. So we had a quick discussion about don't put the signs on a stick as you walk around the building so people think you're picketing the hospital.
We will not have it in any way look like a
that
protest.
Was Diane's concern, is that people driving by won't quite understand. So
No, it will all be for encouragement of the staff. So thank you again. Have a great rest of your week and a great weekend.